Okay guys, we're here to talk about the ACL ligament. What is the ACL ligament? ACL ligament, as you see up there, stands for Anterior Cruciate Ligament. Cruciate because it crosses over. So if we zoom in, I'm actually looking at the backside of your knee, looking forward, yeah. So you can see how it starts way towards the front right side here, and it actually goes backwards and connects to the condyle. So the ligament actually helps protect the knee and limits the amount of knee extension that your knee can go into or straightening your leg, as well as rotary movements, more internal rotation than external rotation of the tibia. So what that means is if it's your left ACL, it would limit the foot coming towards us, which is knee extension, and pretending like that leg was rotating in, kind of like if you're walking pigeon-toed, that kind of movement. It limits that more than it does going the other way, or tibial external rotation. But the point is, it does limit both rotary movements. Now, most commonly, this is torn in a non-contact sport where you're quickly decelerating, planting, and twisting. So fun fact, you guys probably already know that women are more likely to have ACL tears. But there was a really cool study that showed how movement specialists can help train and help teach, in this case, female soccer players, how to jump, how to properly cut, how to land softly. They decreased the ACL injury rates by a whopping 88%. That tells us how much of a role our neuromuscular system plays to help decrease injuries. So that kind of ties into what can we do about it. Well, it depends on where you're at in your stage. I technically see people as soon as they've been injured, even before they've had surgery, which they know they're going to have, because it's really important to get that knee strong, to get good range of motion before your surgery. And then I'll see the athletes, or whoever it may be, immediately after their surgery, based off the physician's protocols. And then I'll see them up through their performance, however long they want to take it. So it's tough to say exactly what they need based off of where they're at in their continuum, but I will say this. As I stated earlier, it's really important to tap into the neuromuscular system. There's one set of muscles that I do want to point out in terms of their importance, and that's the hamstrings. The hamstrings have what's called a posterior tibial glide moment, and what that does is help complement what the ACL limits. So if you get really strong hamstrings, that's going to help what the ACL does. And remember, the ACL limits the knee going that way. So look at that. If I get strong hamstrings, I can pretty much cancel that out. It's really important to teach the kids, teach the athletes, how to land properly, how to jump, and to make sure that they're using the right set of muscles at the right time. And that's how we can help you guys the most. So hope that explains and provides some answers to the ACL ligament, its pathology, its rehab, and what we can do about it. Okay, thanks guys for tuning in.